Our guest panel tonight includes Ann Swanson. Ann specializes in research-backed wellness for arthritis and chronic pain relief. She's a licensed massage therapist, yoga for arthritis instructor, and Tai Chi for arthritis instructor. Her book, Science of Yoga, has been translated into over 15 languages, and her free app, Wellness by Ann, features accessible video practices for pain relief. Next is Dr. Steffany Moonaz. Dr. Moonaz is the founding chair of the Maryland University of Integrative Health Research Department and currently serves as the director of clinical and academic research. She is also a yoga therapist and teaches the nation's only Masters of Science in Yoga Therapy program. Dr. Moonaz has over 20 years of research experience in integrative health, including yoga, obviously, nutrition, herbal medicine, acupuncture, and more, with a focus on arthritis and chronic pain. And lastly, but certainly not least, is Dr. Carl Heldman. Dr. Heldman is a manual physical therapist at Emory Physical Therapy, specializing in spinal rehabilitation, connective tissue disorders, and pain. He's a certified athletic trainer with a master's degree in education and has completed his certification of myofascial trigger points. Dr. Heldman speaks nationally and internationally on manual physical therapy interventions for a variety of treatment strategies. So thank you to our panelists. And without further ado, I'm going to hand it off to our first presenter, Dr. Moonaz.
Thank you so much, Robin. It's a pleasure to be here, and I'm excited for tonight. We have a great panel here, and I think we're all going to learn a lot. So the goals for this session tonight are to look at the evidence behind touch therapies, including how to decide what might be right for you, considerations about what you may need to think about with regard to safety, things to be careful about related to touch therapy, and then some strategies that you might be able to use at home, either in between sessions with a provider or as an alternative to care from a provider. Next slide. Okay, so first, what are touch therapies? What exactly are we talking about here in this category of approaches to care? A touch therapy is defined as any treatment that involves touching or manipulating parts of an individual's body to ease pain, promote relaxation, and a general sense of well-being. And as we'll see, the vast majority of these therapies do actually involve touch, but some also involve near touch or almost touch. Next slide. The therapies we'll talk about, and these are going to be in my portion of the presentation, divided into categories of how robust the evidence is for those therapies. And those include acupuncture and acupressure, therapeutic massage, chiropractic care, biofeedback, manual physical therapy, and energy therapies. Okay, so we'll start with the category that has the highest quality evidence. And, you know, as I divide these into categories of evidence, I want to first preface it by saying that lack of evidence is not evidence of lack. That's something we like to say in research. And what that basically means is just because there isn't a lot of evidence to support something yet doesn't mean it doesn't work. It may be because there hasn't been enough research done yet to determine whether or not it's effective. It may be because the research that's been conducted is of poor quality, the study designs weren't strong, and so even if the findings were very positive, we can't put a lot of stock in it yet. So I am not suggesting these things work, these things don't. What I'm suggesting is these are the things that we have the most evidence for at this point. So when it comes to highest quality evidence, we'll start with, next slide, acupuncture. So acupuncture oftentimes is thought of as being the needles going into the skin at certain points of the body. Acupuncture is actually, I think there should be a slide before this that actually defines acupuncture. Nick, if you want to try to go back one, or maybe it's missing. Yeah, okay, that's fine. So go back. Yeah, so acupuncture is actually a therapy that includes a variety of different modalities. So each of the modalities within acupuncture involves stimulation at identified acupuncture points or along meridians or channels, but it's not always with a needle. It might be with a massage technique. It might be with something that's called moxibustion that uses herbs. So it might be with, as I'll get into, laser guided or electrostimulation. So there are a variety of different ways that those acupuncture points might be stimulated. The needles being sort of the most common and widely used. Acupuncture by far has the strongest evidence for, especially for chronic pain largely, and arthritis within the broader category of chronic pain, because of its track record of effectiveness, because of the robustness of the research behind acupuncture. It has been approved by Medicare for the treatment of chronic low back pain. That actually just happened about 2 years ago. And so we're starting to look at what are the effects of providing acupuncture treatment for Medicare patients. And it may be that other indications beyond chronic low back pain begin to be covered as well. There is some research suggesting that acupuncture is even more effective for knee osteoarthritis than conventional medical treatments with fewer adverse events. So when we're looking at conventional medical treatments for knee osteoarthritis, those are usually things like pharmacotherapy, combined with exercise, maybe some injections, and then ultimately surgery. And so acupuncture might make sense as part of a comprehensive healthcare approach for the management of knee osteoarthritis. Now you'll see throughout this presentation, there's a lot of evidence around knee osteoarthritis. This is the same as the overall issue, which is it's not because acupuncture is most effective in knee osteoarthritis. It's just because knee osteoarthritis is the population that gets studied the most. When it comes to chronic pain research, the vast majority of the research is in chronic low back pain and knee osteoarthritis. So that's what you're going to see over and over again. It doesn't mean that acupuncture wouldn't also work if you had osteoarthritis in your shoulder. It's just that there are very few studies that are done in that population specifically. There's a whole lot more evidence available for low back pain and knee OA. Interestingly, though, there are some studies that show similar results with acupuncture and sham acupuncture. So I just want to make a note about sham acupuncture. When we conduct a research study, we always want to have a comparison group. So one group gets acupuncture, the other group gets something else. And then we look at the two groups and we compare what the difference was. If we didn't have a comparison group, we wouldn't know if acupuncture was the reason why people got better. Maybe they were just going to feel better on their own. Oftentimes, a sham acupuncture treatment is used as the comparison group, which either involves a needle that retracts, so the needle doesn't actually penetrate, but the point might still be getting stimulated by the sham needle. Or they use a real needle, but they use it somewhere on the body that's not an acupuncture point. The trouble with that is that the whole body is filled with meridians of all sorts, and you're stimulating something no matter where you put a needle. And so the idea of comparing acupuncture to sham is a little bit problematic. It's not as clean of a design as comparing a drug to a placebo pill. But what it suggests is that some of the reason why acupuncture works is not just about the needle or the location. It's probably also about the environment, about being able to relax, about the what we might call the healing presence or the loving kindness or the care of the provider, and the other strategies that an acupuncturist uses beyond just the needles. So that's something to consider, that acupuncture is not just about the needles, but a comprehensive care strategy. Next slide. There are actually very few risks with acupuncture. And I say acupuncture therapy because that includes sort of everything that an acupuncturist might do beyond just the needles themselves. The greatest risk is from pneumothorax, which is a lung getting punctured. This is very, very, very rare. It almost never happens, so it's almost not worth mentioning. But it is worth noting that it's actually less likely to happen if you're getting acupuncture from a licensed acupuncturist than if you're getting dry needling or acupuncture from a healthcare provider who's not a licensed acupuncturist. So just something to keep in mind. Now, it is possible that you will experience some really mild side effects from acupuncture. One, if you have a fear of needles, acupuncture is probably not the best strategy for you unless you want to use an alternative way to stimulate the point, like acupressure or one of the massage techniques that acupuncturists use, or the dried herbs. So there is potentially anxiety or fear related to the needle. There's potentially discomfort where the needle is inserted. And because of what's happening with all of the shifts of energy, some people do experience fatigue after they've had an acupuncture treatment, especially toward the beginning of the care process. Next slide. Okay, so at home, it is possible to use acupressure on yourself. So you would be using your own body to stimulate acupuncture points. Obviously, we can't necessarily reach all of the acupuncture points on our body. Also, with acupuncture, you usually have multiple needles in at a time, stimulating different places on the same meridian. We can't really do that very well with our own two hands, but there's something that can be done at home. And actually, Anne's going to share some of that with us. There are also some interesting things emerging, especially now that we're in sort of a telehealth environment. What can be done remotely? So laser guided acupuncture can be done remotely. And then electroacupuncture is also used. So there isn't as much research on these strategies as there is on needle acupuncture, but those areas are emerging. It is important, if you're going to be doing these strategies at home, that you talk with a healthcare professional. Ideally, you get some guidance from somebody who has expertise in acupuncture points, what they do, why you would be stimulating them, and especially that you speak with your treating physician, because there may be a reason why it's not a good idea to stimulate a certain point of the body, especially to apply pressure, perhaps in places where you may have arthritis or degeneration or bone loss, etc. So there are some contraindications to acupuncture, certain points or certain types of approaches for RA, for cancer, for people who have bone disease or are pregnant. So for those indications in particular, you want to make sure to consult with an expert before proceeding. Next slide. Okay, so when it comes to massage, we do have some evidence that there are both short-term and long-term benefits. When someone gets massage, they're getting a hands-on manipulation of the body with the idea of reducing pain, increasing relaxation, and improving well-being. One of the ways that that might be particularly beneficial for people with arthritis is that when you are living with arthritis pain, you may have muscle tension. Sometimes when we're experiencing pain, we tense the body in order to protect a certain area. Sometimes when we have arthritis pain, we might be compensating, trying not to use one body part by using another, like favoring one side, for example, that can lead to muscle strain, tension, tightness. And so massage can be helpful in working to address that. Also, arthritis is associated with stress. It's stressful to live with arthritis, and also stress makes arthritis pain worse. And so therapeutic massage can help to break up that cycle between stress and pain, because it can intervene both on the site of the pain and also can help with stress reduction. Now, when we're looking at what the research evidence shows, it suggests that massage is more effective than not getting any treatment. Okay, so getting a massage is better for pain and stress and well-being than not getting massage. However, massage does not appear to be as effective as some other first-line treatments like acupuncture, physical therapy, and chiropractic care. When we're looking at massage for people who have chronic pain and arthritis, a level of moderate pressure may be best. There are a variety of different therapeutic massage techniques, and Anna's going to demonstrate some of those in a little bit. But a lighter pressure may avoid some of the pain and discomfort that can come from massage for people who are living with chronic pain. There is an idea that if you have stimulus that is sort of inert or neutral or even pleasant, then that can override some of the pain sensation that's traveling from the body to the brain. So massage can be a way to disrupt the pain signaling that you may be experiencing from arthritis. Next slide. Before you get a massage, first look for a massage therapist who, of course, is licensed, but also ideally who has specialized training and experience working with people who have arthritis. So Anne is here with us this evening. Not only is she trained in massage, but she's trained in how to provide massage to people with arthritis, has a lot of experience doing that, and even trains other people too. So, you know, the kind of the safety that you're going to experience from a massage from somebody who has that kind of expertise is very different from going to someone without it. Also, be sure to communicate, and I think this goes across the board, not just for massage, but for all of these touch therapies. Communicate about any discomfort. Just as we say that when we're talking about yoga, we want all of these therapies to be non-harming. If it's painful, if it's causing discomfort, there's a way to address that. There's a way to adjust, to stop, to try a different strategy, to try a different technique, to, you know, change the pressure, etc. And so if you're experiencing pain or discomfort from the massage, it's not productive. It's going to be more stressful instead of alleviating stress. It's going to cause more tension instead of alleviating tension. And especially if you're experiencing any discomfort in your joints, because massage should really be happening in the muscles, not in the joint tissue. Next slide. What can you do at home when it comes to massage? So you may have seen these massage guns on the market. The way that Anne has described it to me, these really are best to sort of like loosen up muscle tension in preparation for a massage, as opposed to actually being an alternative to the massage. Now, if that's all you have, then it's probably better than nothing, but it's not going to be as beneficial as actually getting a massage. If you're looking at foam rollers, which can be really wonderful if you have the right kind of foam roller for your body, for that particular body part, that it's not too firm, that it's uncomfortable, that it's not too small, that it's sort of pressing into your body in an uncomfortable way, and that you have techniques that you can use with the foam rollers that are ergonomically safe and appropriate, that you're not, again, causing harm or tension in the body in the process of trying to alleviate it via the foam roller. Self-massage, and again, we're going to get a little experience of this, but you know, a lot of people think, well, I can't give myself massage because I have arthritis in my hands, but there are actually things that you can do to give yourself a massage that reduce the amount of discomfort that you might experience in your hands or fatiguing of the hands in doing so. There actually is a little bit of evidence that massage chairs can be effective. There's some evidence that they can help to reduce pain and can improve quality of life. But if you compare a massage chair to a therapy that's established like physical therapy, it's not going to be as effective. And then, of course, you could also ask a family member or a friend to give you a massage. Again, go for moderate pressure and speak up if anything is uncomfortable. Don't be afraid to advocate for yourself in terms of what kind of pressure feels okay, any places that you would like them to avoid, parts of the body where your arthritis is particularly active, for example. Next slide. Okay, for chiropractic care, chiropractic is a system of care again, and it focuses especially on the structure of the body and in particular the spine. Now, just like could be said about acupuncture, there is more than just the needles, right? So with chiropractic care, it's more than just the spinal adjustments. Chiropractors also can make recommendations for nutrition and mind-body practices. They can recommend exercise, particular exercise. They can do bracing and taping. So it's not just the spinal adjustment when we're talking about chiropractic care. The strongest evidence for chiropractic care is for chronic neck pain and chronic low back pain. Now, when it comes to both of those indications, chronic neck pain and chronic low back pain, the evidence doesn't really break it up. So we don't know what conditions we're talking about when it comes to neck pain. Are we talking about herniation? Are we talking about degenerative disc disease? Are we talking about spinal stenosis? It's not really broken down like that. It's just neck pain in general. And the same thing goes for low back pain. There are many reasons why people might have low back pain. And all we can say is that chiropractic care works for low back pain, but we don't know how well it works for one type of low back pain compared to another. Much of the research looks at spinal manipulation alone. So you don't see a whole lot of the research that looks at chiropractic care as a whole system. You tend to just see the spinal manipulation. And honestly, in speaking with some chiropractors, they suggest that the spinal manipulation may not even be the most effective part of chiropractic care for some forms of arthritis. So the benefit you might get from spinal manipulation may not be as great as the benefit you would get from comprehensive chiropractic care. There is evidence that both higher and lower force manipulation appear to be effective. So it also is fine to go to a chiropractor and say, I would prefer that you not use a lot of force. There are gentle chiropractic techniques that can be effective. And those gentler approaches may be especially important for people who are at risk with high force approaches, including people who are frail, elderly, have osteoporosis, people who are in pain, or people who are anxious about having a high force adjustment. Next slide. Okay, so when you are seeing a chiropractor, ideally your chiropractor has access to your medical records so that they can see specifically what's going on in the spine or the knee or the neck, whatever parts of the body you're hoping to address. They should really know what the underlying pathology is so that they can be particularly careful and use appropriate strategies. As with all of the other providers, communicate. Let them know what your concerns are. Let them know about where you have pain, what makes the pain worse, so that those kinds of things can be avoided. And you may want to also ask a chiropractor what other strategies they might suggest aside from or in addition to spinal manipulation. You can also let them know about any reasons why a low force approach may be appropriate for you. And, you know, chiropractic oftentimes is referred by medical doctors. So your treating physician might have a chiropractor in mind who's going to know about your particular condition and who they might recommend. Next slide. When it comes to manual physical therapy, and we have Dr. Carl Heldman here, who's going to give you some examples of that, you'll see that a lot of the approaches here are similar to what we've already seen. in terms of massage, joint manipulation, joint mobilization, passive stretching. These are some strategies that chiropractors might use, that massage therapists might use, that acupuncturists might use, but they're going to be slightly different and guided by different underlying theoretical concepts. Next slide. When it comes to manual physical therapy, it is most effective when it's combined with exercise that's prescribed by a physical therapist. So when we talk about physical therapy, many of you are probably thinking about physical therapy exercise, and manual therapy can be used in conjunction with PT prescribed exercise. We don't really know how effective the manual therapy is compared to PT exercise because they haven't been compared in the research. But what we do know is that manual therapy along with PT prescribed exercise is about twice as effective as a home exercise program alone. Manual therapy from a physical therapist is also more effective than electrotherapy for pain, range of motion, strength, and functioning in knee osteoarthritis. Again, we don't know about other forms of arthritis because that's most well studied. Next slide. When you're working with a physical therapist, they will usually give you recommendations for things to do at home. And so stretching and strengthening exercises can certainly be done at home. You ideally want to get guidance from a physical therapist or another qualified healthcare professional so that you're doing exercise that's going to be safe and appropriate for you. It's important when you're exercising at home to work well within the limits of your strength and flexibility so that you don't overdo it and end up causing harm. And if you are experiencing any discomfort beyond just being a little bit sore from the physical activity, you want to make sure to report that to your healthcare provider. Next slide. In terms of moderate evidence, next slide. Biofeedback is anything that gives you information about how your body is functioning. And when you have that information, you actually can use your mind to control what's happening in your body. So there are lots of different ways that we can do this. A really simple example is if you put your hand on your heart, you can feel your heartbeat. And believe it or not, just feeling your heartbeat, you can intentionally start to slow the heartbeat. Your body does all sorts of things to self-regulate all the time. And some of that can be controlled when you're getting that sort of feedback loop. So this can be done with skin temperature, brain waves, your heart rate, your respiration, skin conductance, which can be a marker of stress, your blood pressure, tension in your muscles. So, you know, if you are getting feedback that your shoulder is tight, there are things that we can do with the mind to relax the muscles in the shoulder. Biofeedback can be used by a lot of different kinds of healthcare professionals, and it might be used for different purposes. Next slide. There is a meta-analysis which looks at a bunch of different research studies of people with chronic pain that suggests that biofeedback can improve pain intensity, depressive symptoms, which are common for people who have arthritis, muscle tension, and our ability to cope with the chronic pain. It seems that longer treatments are more effective for reducing disability, and having more frequent sessions helps with depression management. Biofeedback is effective both short and long term. So that means when you get the biofeedback, it improves health outcomes right then and there. But then if you get biofeedback over time, you're going to see a steady change in outcomes. There is evidence for biofeedback for chronic pain in general, but there is not evidence for the application of biofeedback to arthritis pain in particular. So we don't know how biofeedback works for people with arthritis pain, but it likely is similar to how it works for chronic pain in general. Biofeedback can actually also be used to help us control our posture and the way that we walk. And so that's an interesting application to arthritis management. Improving the way that we stand, the way that we walk might also improve arthritis pain. Next slide. When you're looking for somebody to administer biofeedback, try to find somebody who's certified, which is not a requirement to be able to provide biofeedback, but it's recommended. So you want to seek out somebody who's trained and qualified. If you are uncomfortable, physically uncomfortable, or mentally, emotionally uncomfortable, make an adjustment or stop And of course, that's true with any of these therapies. You can do some biofeedback things at home, like I just said, with your heart rate, with feeling your pulse, with controlling your breath, or there are some apps on the market where you can actually get feedback about what's happening with your own body in order to manage those kinds of things. Next slide. In terms of low evidence, next slide. There's not much when it comes to therapeutic touch, healing touch, and Reiki. So these are some of the areas where I said it may be hands-on or hands slightly off. So for these therapies, they involve either putting hands on or near the body with the intention of shifting energy. We don't have a lot of evidence because not a lot of research has been done. We also don't really understand the mechanisms for how these things work because they're related to energy, which is not a concept that's well studied in the Western research literature. Next slide. There is a meta-analysis of 4 small randomized controlled trials that showed a reduction in pain with Reiki compared to control groups, but there was another paper that came out disputing those findings. There's a review that suggests that some of these therapies may be beneficial for palliative care patients. Most of the research that's been done on these therapies has been done in cancer patients. So we really don't know what the effectiveness is for chronic pain or for arthritis in particular. They tend to be very low risk. And there are some things that you could do at home that might be similar, like using guided imagery and visualization practices. Next slide. Okay, so I'm actually going to turn it over now to Dr. Carl Heldman, who's going to give us a demo on physical therapy manual approaches.
All right. Thank you very much, Steffany. As I said, my name is Dr. Carl Heldman. I live down here in Atlanta, Georgia, and I am going to speak today on orthopedic manual physical therapy and some exercise tips for arthritic conditions. The thing that we get into with therapy in my 30 years doing this, oh, come on now. Come on, computer. There we go. Is no one ever walks into my office and say, ow, I have a bad arthritic knee or something like that. They come in complaining of pain. You have pain for some reason. There is something going on. We're trying to figure out why you have the pain, where the pain is coming from. And maybe by changing the biomechanics and changing the way the joints can move with effect to the soft tissue and the joint structure itself, this is how we get to do that. And then we reinforce that with exercise to try to get things working a little bit better. So the idea being is that we always come back to go, what treatments are appropriate? And the treatments that we do are a lot of manual hands-on therapy because that is my bias. It is the way I'm trained. So one of the things we get into when we get to joints, though, is that we have to respect on where they are in their stage of inflammation, stage of possible degeneration, or just stage of overall treatment that needs to happen there. So some of the things that we have here are some more what we call soft tissue approaches, which are like the more myofascial type therapies. And this is a by no means an effort, not an inclusive list. It's pretty good. There's probably 1 or 2 things that should be added to this. And then at the end of the list, you'll see where there is manual manipulation and mobilization in there, because if you are moving the joint, you are effectively hitting the soft tissue around that. But the thing that we get into, as we said before, as we understand it, is that manipulation in itself is really worth trying to target the joint structures. The thing we always have to respect for, as you can see on the slide on the left-hand side, on my left-hand side actually, is that we have to pay attention to where we are in the process of the joint and what's happening and how's it moving and what is happening here. So within that process, we talk about what do we do here with hands-on? Okay, so we talked about myofascial, we talked about joint, but as we've said before, there are a few randomized clinical trials evaluating efficacy. It doesn't mean that, hey, we don't move it, it doesn't feel better. It does. We just don't have a lot of background information right now to let us know what is happening, how's it happening, and are we truly getting the therapeutic effect that we need. It's also never done in isolation. That's the usual big thing that we do here, is that most treatment that we do in a classic physical therapy setting is done by cumulative movements, cumulative load, and lots of cumulative modalities into doing that too. So because we're trying to find what's that right mix to get this person moving and working back there. So it'll also vary by practitioner. That will depend on the person's education, how long they've been out, if they're fellowship trained, have they done anything extra out of that. It's also very difficult to study because pain is a very individualistic situation for everybody. How we deal with pain, how we look at pain, how we interpret pain is a very individualistic thing. So it has a wide range on how to do that. We try to do some standardized tests and measures to show this, but right now I think we're still, as we've said before, in a better way of identifying research methods that may better accurately address and assess this. And then also too is that does one go into the next, or does one validate the next level of arthritis that somebody's happening, i.e. how does osteoarthritis differ from rheumatoid, from psoriatic, from like a spondyloarthropathy? So, and that's the whole point of trying to figure that out. So there are a few clinical studies I just want to kind of just glance over real quick to kind of just show that there are some things that are out there, but again, they're just starting. They're not really well studied yet because they don't show us the long-term range of what's available. But here in this first one here, it shows, hey, with grade 1 OA for the knee, that hey, we show that with the increased the motion, the flexion extension stress, we had improved function because pain went down. We showed immediate and some short-term effects that persisted for a couple of days after treatment with this. And obviously to go for more long-term studies is be like, okay, we've done this treatment. Do we actually get a projection for a change that is longer in the scope, as in 6 months and a year, that is more for the patient benefit long-term treatment needs? Idea here is there are a small pilot study that they talked about rheumatoid arthritis that has just come out past couple of years. And what they do is they do a contract relax idea with the joint, a little bit of joint mobilizations. And here, when they did the study, it went 10 sessions on, 6 days on a break, and then 4 days. Unfortunately, in the most classic settings, we usually see people 2 to 3 days in a week. And in these studies, they're harder to translate some of that benefit over to that there. But again, we may see with other things that are better structured from a clinical perspective to then show us a better research way. Last one is effectiveness in trigger point dry needling. There is a definite evidence that shows that immediate 12-week follow-up in the initial stages of a flare-up are beneficial into things, and they do work, but beyond that may not be as great. I've been doing dry needling for 15 years, and I can say that it's definitely a little bit all over the place with this. That it is definitely one of those things that do help people, especially when we get the muscles to release around the joint to take those joint pressures off and change those loads. But it's definitely not the cure-all for everything. And that's with most of these things because it is part of an integrated treatment, okay? The point being here is that everything happens together. It doesn't, happen in isolation in itself there. So when we're looking at the patient, we're looking at how they move, we're always trying to figure out, okay, where are we at? What are we doing here? So this study I like to refer to because this is for AS, ankylosing spondylitis, for those that don't know or have not heard of it. It's probably one of the bigger rheumatological things that I've ever spoken on and have treated patients with that are harder to treat than your basic OA. So with this, when this came out, they came out with this consensus statement, and they show this idea of these 10 recommendations where we're talking about assessment, monitoring, safety, disease management. That may be through pharmacological needs. That may be through a surgical intervention that needs to happen because of the process of the arthritic changes down the road. Okay. Does it need to be specific mobility? Does it need to be other? Do we need just general physical activity? What's that dosage? What's the adherence? Every dosage might be different for every body. So the stuff that we're going to be showing here on this little slide that we're just going to use as a kind of demonstrating model is exactly that. It is not a way of treating everything or everyone, because that's impossible without taking the full picture of the individual person into consideration. One thing we just want to look at, and these are kind of the two common models here when we're looking at what a healthy joint looks like, what the osteoarthritis looks like and what the rheumatoid arthritic joint kind of looks like individually next compared side to side. And I chose these because these are the ones that are more commonly out there in the literature, obviously because the knee is the most heavily studied out of all the joints. So we can see these changes in the stage of knee osteoarthritis where somebody may have these degenerative changes over time. Their movement in stage 4 is going to be different than their movement in stage 1. That has to be taken into account. The same thing when we're into a rheumatoid situation. Do we have somebody that's ankylosed? Do we have somebody that's in just a synovitis flare? There's going to be a differentiation within both. But the big point on all arthritis is that we want you moving, because by getting movement back, pain goes down, function goes up, and it decreases the disability into the individual. That is the end game out of everything that we put together. So with that, please take a screenshot of this. It is not inclusive of everything, but it's showing you some very basic maneuvers that are helpful and are kind of global in their nature. So you'll see the first picture with the man just kind of stretching behind his hands. You don't have to get the hands behind you if you can't. The hands may come in front of you and just pull down through the shoulders and have just a nice little stretch there. The other one is the man's holding the stretch in front of him where he's holding his hands kind of in this kind of a nature, pushing forward. So your hands will kind of come forward into a shoulder stretch. The next one is the pulling of the elbow behind, kind of reaching behind the arm. Obviously, if you could not get that, you could use like a wand or a towel with the bottom arm coming up underneath to adjust that. The next one is a lunge stretch for both the hip flexor in the front and, I hope you all can see my cursor, and to the calf in the backside there. Another way of modification is doing the lay down stretch for the hamstring. Very nice for opening up the back posterior of the hip. And the other alternative, if getting down and up is hard, there is the standing box hamstring stretch that can be done in place of that. If you come to the next two middle slides, you'll see variations of the quad stretch where it can be done both in standing and in a prone position. The next one is what we call a figure 4 stretch, where the ankle is going across the knee and the knee is coming to the opposite shoulder. That can be done with the foot in an elevated position, or if that is absolutely uncomfortable, the foot can be down on the ground with the other knee across and pulling through. The middle one with the gentleman standing there is he's just literally going from side to side across the hips. The one on the back is kind of, they call that a fish pose in yoga, but that can be broken up into a couple of different things. One, just doing a little bit of an extension with that into the thoracic chest, but also then using the knee going in and out as far as getting some mobilization onto the hip. So it would look like one hip being up, one hip being here, one hip coming out, one hip coming out. The last few are kind of variations of these ones here, where we can see is that the gentleman has got the hips going one way and the shoulders trying to go the other way, is kind of a cross stretch that's there. That can be actually broken down to do the shoulders by themselves and the knees by themselves. Again, if someone has a more arthritic spine that can't do that big of a turn, we can always break these down into smaller movements. That's the big key here. And that's why I love this version of the stretches here, because we can always bring it down to somebody to meet them where they are at. That's the important part. Okay. The double knee to chest is exactly what it looks like, which is the second to the left, or second slide in from the left-hand side. And then you can do a single leg version. And again, you see how the leg is straight there on the single leg version. But again, that can also be done with a bent knee as well. And then the last one is probably the little more advanced, especially if you've got some lumbar issues and some thoracic issues along the way. But again, it just getting into the position and just doing a subtle turn and even the head not going that far can provide some help just spinally and mobility wise. So again, it is not all inclusive, but it gives hopefully everyone who is listening and looking here some ideas on some gentle moves that they can do and incorporate in a daily kind of idea for themselves and get things moving, or maybe build upon what you've already been able to do and work with another healthcare professional. Last one I want to pay attention to is the wrist. It's one that's kind of overlooked, but obviously we do so many things with our hands that it requires a little bit of extra special attention to that there. So there are just some basic active range of motion stretches there. I will say use caution on the two where they've got the patient with the hands kind of placing them down on the countertop there, where the wrists are going back and forth like that. Sometimes just putting them in the position without adding any force to it is enough. For some people, just doing the simple opposite stretch is enough. Okay, that's where you have to kind of make that choice between you and your provider and see what you're doing there. So the conclusion that we want to come up with is the idea is that we're trying to restore function to its most optimal ability of the system, to what you have that is a capacity to you and what can work the best for you to get the most out of what the system is allowing you. And of course, motion is lotion. I preach that every day in the clinic. You know, you've got to do some movement every day. Sometimes it's going to be uncomfortable, but the more often that you do it, even if it's just slow and slow, it gets things moving, it gets things generating. And by even just doing low and slow work that day that you don't feel too good and just kind of moving within that constraint that you have available to you is of a benefit. And that is the greatest thing you can help yourself with. So I thank you for attention, and we'll hope to speak to you at the end of this presentation. Thank you.
And thank you so much, Carl. I'm so glad that you showed those images of the hand movements, because that is so important. And one of the things that holds people back from feeling like they can do yoga is they feel like they can't get down on their hands. And there's so many other options. And some of the options actually that I'll be going through involve some self-massage. So my name is Ann Swanson, and we are going to do a little self-massage for ourselves for the next 10 minutes or so. But I want you to look around your space. And ideally, I actually recommend having a wine cork. So if you happen to have one of those on your desk, you can grab that. But I couldn't even find a wine cork in this house. Did not want to open a bottle of wine at 3 p.m. here in Colorado. So you can grab like a chapstick tube. That would work. Or a pen, but I want you to have this pen be a little bit like this Sharpie is. It doesn't have like a lot of lumps in it. I'm just going to maybe make myself be highlighted. Can you do that for me, Robin, to make me spotlit on the screen since Carl's still spotlit? So find maybe a marker or a pen. We're going to have basically a mini foam roller, which is why I like the wine cork. It has that good texture to it that's like a foam roller, but a chapstick tube or whatever you have for now. And then next time you have a bottle of wine, you can show your friends the things that we will learn. So have that nearby. And we'll warm up our hands by taking our hands and just imagining you're washing your hands. So you're just moving your hands around just like you're washing your hands. This is a light touch. Find whatever feels good for you here. You can even just close your eyes for a moment, readjust your posture. Check in with your hands. How do they feel today with this light touch? And then take them together and rub a little bit faster. It can still be a light touch, but we're just creating some friction, some heat here. Rub a little faster. And a lot of people think that they have to go get a massage, but I actually do a little bit of self-massage every day. So I highly recommend integrating it into your life when you feel like your hands are tired from texting or typing too much. Now that we have some heat and warmth, we're actually going to take it down to our knees. So bring your hands to your knees and just gently rub in circles. One of the keys, though, for self-massage, just as I am a massage therapist, one of the keys for a long career in massage is to be very aware of your body mechanics, particularly your hands. So the things we do strengthen our hands and improve our grip strength, which is great, but we don't want to cause wear and tear on the hands, right? Especially if arthritis is an issue. And I do have arthritis in my wrists and hands, so I'm very conscious of that. So with any of this rubbing of the knees here, you can use your fingers, you can use your thumbs, whatever feels right for you. You can use the ball of the hand or the base of the hand right here, whatever feels right. And I want you to go to the four corners of the knees. So we're going to go on the outer edge where there's some ligaments here and just check in, rubbing wherever it feels good on the hand. Another key thing that we'll just be aware of as we do this self-massage is not to hyperextend the joint. See how I'm doing this here? You would never do that. Is it puts the wrist in a weird, well, this would be the wrist kind of like weird angles. We want to keep a more neutral wrist, more straight. Same with the fingers. We don't want to like lock them like that. So just be aware of that. And then we're going to go to the inner knee now. Going to these key areas that we tend to have inflammation, and just check in. Just rubbing there, however feels good. And then below the knee where the patellar tendon attaches. Sometimes that's where I feel my tenderness, but not so much today. So notice any differences today. And then above the knee. Find what feels good here, just checking in, and go to big circles. Especially with the hands, we don't want to, just because our hands can hurt, shy away from doing anything with the hands, because then we'll lose strength. So with the self-massage, we're being very aware of listening to your body and your hands, not taking it too far, but also we're getting a little strength here of our fingers and hands. All right, just take a moment, sit tall and feel your knees. Bring your hands palms facing up into your lap, which just kind of warms them up, so feel them. And take a few breaths, feeling that little glow around your knees. All right, grab your wine cork, chopstick tube, thick pen, whatever you have here, and we're just going to rub it in between our hands. Soft to moderate pressure, doesn't need to be hard. Basically, this is a mini foam roller. I'm just going to hit all the points on my hands here, and including, I'm going to come down to the wrist, which you may do kind of like one wrist at a time as the focus, rolling around the wrist area, the thumb area right around here, the thenar eminence, we call this. So right around the thumb. Also, and then you can do the other side. So a little focus on the other side. Be aware of your posture as you do this. You could also have your forearms on your desk. I just can't because I'm demoing for you, but just that pressure off of holding your arms up or even down in your lap. That's totally fine. All right, and just a few big strokes up and down here. Let's go now to the pinky side and focus on the pinky side. So we're going to do one side at a time, or else it gets to be a little hard. Well, actually, I'm doing both at once, but I'm really focusing on one at a time so I don't drop it. And find any areas that feel good for you. Just check in. We're increasing circulation to the area, softening up the tissue. Awesome. You can then release down your cork and take your hands and interlace your fingers. And if this is, it doesn't have to be interlaced all the way down, it could be anywhere along the way, but I want you to take it to the upward way. So 1 over. So interlace them wherever works for you. You're just going to do a little roll here. It can be small and gentle, or it could be quite bigger, so like a wave. And then the other direction. Awesome. Release down and feel your hands. Take a deep breath in and a deep breath out. We are going to do a little acupressure. So you're going to take one hand and curl the fingers like this, just wherever they naturally curl down. Now, in between these two fingers, you could take whichever finger, your pointer finger. I actually use my thumb, but if you tend to use your thumb for texting, your thumb might be tired and that might not be good. I never text with my thumb, always my pointer. So whatever works for you, thumb, pointer, whatever finger, you're just going to press there. Notice how my thumb itself is neutral. We're going to hold here for about 30 seconds and release down. So Steffany was talking about the meridians, these channels in our body, according to Chinese philosophy and Chinese medicine, where energy flows. Now, this is an acupressure point along one of these meridians. It's called the Lao Gong point. And this point is really good according to this philosophy for inflammation and anxiety. So that could be really helpful with dealing with arthritis. Just holding here another few moments. Once again, you don't have to hold it up like this. You could have it in your lap. That's just so you can see. And then we'll do the other side. So curl in like this, in between these two fingers, two middle ones, thumb, pointer, whatever works for you, but keep it neutral. Don't want to like lock it in a weird angle or anything. Just keep it neutral. You could be pressing with your nail or with the fingertip, whatever feels good for you. And just as you press here, feel a sense of release, letting go. Notice the effects when we hold this for about 30 seconds, 10 breaths or so. Maybe you can hear your breath as you do this. And then release that, shake out your hands a little bit, and then bring your hands to your lap, palms facing up for a moment once again to just feel the resulting sensations. That is one of those acupressure points that is used quite often. And I do it throughout my day sometimes just to have a meditative moment. So notice the effects for you. And then gently open your eyes. We're going to do just a quick thing for our neck and shoulders. So bring your hand, one hand behind you, and grab your neck like this. And this is also something that, as I'm showing you, you can teach somebody else to do to you, because it's one of the most effective I've found massage techniques, and people will love you if you do it to them. All you do is you grab the neck and you just pull a little up, just gently squeezing. And this depends on your grip strength. We are improving our grip strength right now. Doesn't have to be too hard though. Improving it. And then we'll go to the other side a few times. Super simple thing you can teach somebody else to do for you. Just come right behind you and kind of squeeze like that. Or you can do for a loved one. Sometimes I'll move my neck a little bit as I do this. And then feel that exercise that your hands had and release. Feel the resulting sensations, vibrations, flows. And just allow your energy to settle. We did just about 10 minutes or so of self-massage. I have a whole series of videos if you want to be guided through full body self-massage, headache self-massage, hands, feet, wherever you need. So Robin will put that up for you to do later. But I recommend doing these sort of self-massage techniques after you've taken a shower or bath, so you've warmed up, and you can do it when you're putting on your lotion or oil or whatever you do to keep your skin hydrated. So you have that extra benefit of taking really good care of your skin, which is a large organ that also needs some love. So I'm going to hand it over to Steffany, and we'll do some Q&As. Of course, if you have any questions about this or anything else that's been covered, we look forward to answering them for you. And that link is in the chat for the playlist, as well as I have some hand yoga videos, because that is so important, as Dr. Carl Heldman talked about the hands too.
Thank you so much, Anne. I happened to have a chapstick right nearby, so I was able to participate in an added use for a chapstick that I hadn't thought of. I have a question for you. So when you make your fist, you see how high up your fingers are and how low mine are? How do I find that point when my hands take up my whole palm? Oh, you're muted.
I would go with where your hands naturally land. If you look up online, the pictures of this, this point is anywhere from here to here, depending on the
Oh, okay.
person.
Mhm.
So I would go with where your fingers naturally land.
All right, thank you.
Yeah.
There's a question here about what the best touch therapies are for neuropathy and nerve pain. So, Anne or Dr. Carl, if either one of you would like to respond to that, please. I think you can both put your video on and just hang out, because I'm going to have a few questions for both of you. Would either of you like to answer that?
That's a good one. It's, again, usually multifactorial in its nature. There's not necessarily one way that fits all. There's a couple different treatments that are involved. One of them is called neural tension, where we actually slide and can glide the nerve through the channel that the nerve runs through the system. That is sometimes helpful. Obviously, if the tissue is restricted around there, then opening that up via doing some myofascial work, dry needling, things of that are a nice way to approach it too. And then also too is being what's happening at the spine is usually maybe some of the root or the radicular symptoms there that may need to be addressed in conjunction with the symptomatology that the person is feeling there. So usually those kind of symptoms are have 2 or 3 different layers to them versus just being, I've got something shooting out here, and it can be from different areas. You may have a couple of areas that need to happen. And one of the big ones we use in classic demonstration is something called thoracic outlet, where the nerve that runs from here into the neck can go all the way down to the hand, and it can get jammed up in different points along the shoulder as it travels to the hand as that signal goes, and that can disrupt the neural supply, but also disrupt the vascular supply. So that one there is not as straightforward. It definitely requires a better deep dive into pathology and what the person is doing than it having being just like, hey, do these 5 things.
Yeah, absolutely. Thank you. And Robin, I actually put in the chat a link to a case report that I published with a colleague of mine on the use of yoga for neuropathy, just to throw that in there. And is there anything else that you wanted to add about touch therapies for neuropathy?
I think I agree with both Dr. Heldman and you in that it's multifaceted. And as a movement expert, it's hard to not be like, well, I think Tai Chi would be great for that, because it's really bringing awareness into your balance, and it's slow moving, as well as yoga. So I would definitely combine it with movement. Another thing for me when I get massages, and maybe one of the reasons it works so well for me, is I do it as a meditative experience. I feel each area that the person is touching, and I put my attention there, try to release that area with them. So that'll help you connect your mind and your body, so to be able to have that feedback to your brain.
Great, thank you. There's a question here, and this one I'll throw to you, Dr. Carl, about the use of a TENS unit for arthritis pain. And I know that's something that physical therapists often use.
We do sometimes with chronic pain. It has a limited effect depending upon the degree of the arthritic change that it's happening at the joint level is the big deal there. With early OA, because of pain and disruption through, I think you mentioned it before with the gate theory, it works on to stimulate those larger afferent fibers. The challenge again is it beneficial for the individual in symptom management? Again, it's not going to cure anything, but will it help them in the management and self-efficacy management of their symptomatology as a kind of whole package that is there? You can play with some different frequencies depending upon the unit that you have. And sometimes some alternating pad placements can be of benefit, but even the research out there on it is not great.
Yeah. Okay. Thank you. And for you, Anne, what would you say is the best type of massage for arthritis? There's a question about whether deep tissue is okay. And how about especially during a flare?
So I would avoid deep tissue during a flare. Now, deep tissue could be fine for you, depending on what feels right for you. And you have to communicate really well with your massage therapist. For example, if you have knee OA, maybe they're giving you deep tissue in your back, and it's just that's what you like in your back. I generally recommend Swedish massage, and you could go a little firmer for that moderate to firm touch, which is where the most evidence seems to be. And Swedish massage, one of the benefits is that it's going toward the heart, which is physiologically working with your circulatory system. You're helping to return the venous flow back to your heart, as well as your lymphatic flow, which could be really helpful because arthritis affects your immunity, and especially a systemic arthritis. So I usually say Swedish, and you can ask to go a little firmer. It just means that they've been well trained in that sort of technique that is based on modern physiology.
So there's a question that is more general about the use of touch therapies during flares, during pain flares in particular. And, you know, many forms of arthritis flare, and the flares in a systemic arthritis are different than the flares in something like, you know, osteoarthritis or low back pain. I would say that touch therapies aren't necessarily contraindicated during a flare, except that they're going to be different than what is indicated when you're not in a flare. So it's especially important to communicate with your provider. You can also reach out to your provider and say, hey, I'm having a flare. Should I come in, or should we reschedule, so that you can have a conversation with your provider about what's going to be most beneficial for you. I would also say that some of these therapies, you may experience some fatigue after the therapy. And if you are in a systemic flare that's associated with fatigue to start with, that may be something to consider. If you're in an RA flare, a lupus flare, and you're experiencing fatigue, is an acupuncture treatment going to exacerbate the fatigue, or is it going to help alleviate the fatigue? And it probably depends on the approach that's used. Additionally, consider what it requires of you to go and get that session. And is that going to be exacerbating fatigue and pain? It may be that some of these at-home strategies would be best used when you're in a flare, so that you can give yourself a little bit of self-care without all of the stress and effort that's required to go to a healthcare visit. I'm interested in whether either of you wants to add something to that.
No, I think you hit it pretty good right there on that. The challenge always is that is getting to the location worth the outcome,
Right.
and worth the effort of making travel, getting there, versus being like, you know what, I just need a recovery day. I just need a moment.
A warm bath.
Yeah, you know, hey, I need a pint of Haagen-Dazs, some meds, and a good Netflix binge, and I'm good to go.
Yeah, and there's also something to be said for becoming part of your habit and routine, and that maybe you have a self-care day where you do take the bath. You know, every Friday I take a bath, and I do a scrub on my body, and then I put lotion on my body and do self massage. You know, so it's putting it in your routine. I know that's hard, and we tend to want to just fix it when we get to that point. But as somebody that deals with joint pain myself, I know that routine has become something that makes a huge difference.
There's a question about what touch therapies are covered under Medicare. And so certainly physical therapy is covered under Medicare when it is prescribed. Massage therapy can be covered, and acupuncture is only covered for chronic low back pain, as far as I'm aware, though, you know, hopefully that will change. There may be some of these other modalities that could be covered under an umbrella. So for example, biofeedback could be covered because biofeedback can be provided by a psychotherapist, for example. And so if the psychotherapy is covered, the biofeedback could be covered under that. Chiropractic care can be covered. So I don't know if either one of you wants to say more about Medicare coverage in particular.
Usually it's good rule of thumb is whatever the practicing licensed individual is able to do under their Care Act within the state that they practice in.
Right.
And if they are under a Medicare provider listing, then they're going to be okay with that.
Right. Yeah, the same is also true for acupuncture, that many licensed acupuncturists are working in private practice, and acupuncture can only be covered by Medicare if it's under the umbrella of a licensed Medicare provider. So that would tend to be a medical doctor or a doctor of osteopathic medicine that the acupuncturist is working under. Is acupuncture suitable for all types of arthritis and not just for knee OA, for spinal stenosis or structural knee problems? So what you have to understand about acupuncture is that it's operating from a completely different theoretical model. So acupuncture does not, when you are seen by an acupuncturist, they're not looking at your spinal stenosis. They're looking at the energetic imbalances that are underlying your whole system. Your stenosis may be a part of that, but they are working with the whole person. They want to hear what symptoms you're experiencing. They want to know what's going on with you physically, emotionally, etc. But they're going to choose an acupuncture approach that looks at the whole person. And so when we study acupuncture, we're usually studying acupuncture for a Western medical diagnosis, like acupuncture for knee osteoarthritis, acupuncture for, chronic low back pain. And each person who has those things is going to be treated differently by an acupuncturist depending on a whole constellation of factors. So we're really looking at, we're using the wrong tool for the job when we study acupuncture the way that we study it from a Western medical perspective. So that being said, we really can't know whether acupuncture is going to be effective for this Western medical diagnosis compared to that Western medical diagnosis, because it's going to depend on the person and it's going to depend on the treatment that's provided. The way research tends to happen in acupuncture is, let's give everybody with knee osteoarthritis this treatment. But in reality, each person with knee osteoarthritis who goes to an acupuncturist is going to get a completely different treatment. Maybe some overlap, maybe some similarity. So it's a challenging question to answer because of that. But generally speaking, acupuncture is incredibly effective for chronic pain. So if you're looking for the management of chronic pain, and acupuncture is incredibly safe, has very low risk of adverse events, probably doesn't hurt to give it a try. There is a question about how to know if your physical therapist has experience in your type of arthritis. So Dr. Heldman, for you, if you can respond to that, as well as, is it recommended to warm up before doing the stretches that you suggested?
Okay. The individual arthritic challenge is that usually in PT practice, we don't just specify one versus another arthritis. There's usually, when we are trained to do things, we are looking at arthritis as either a local or a systemic event, and then the variations or the manifestations within that. Unfortunately, not everyone's going to get exposure to the same level of some of the systemic ones, like an AS, like a psoriatic arthritis, because we just don't get the opportunity to see them as often, or in some cases, they just don't want to come in because in a traditional setting, they've been in there before and it didn't go well. It did not go well at all in just the basic Therex kind of mill situation. So my recommendation would be to find a physical therapist that has a manual therapy background, or somebody who's been fellowship trained by the American Academy of Orthopedic and Manual Physical Therapists. These are people that have done extra work outside of the normal contexts of PT school, but don't discount the practitioner that's been out there for 30 years, because they've been out there for 30 years. So they've seen a lot, they've treated a lot. So we can't just say all certificate, all training, 30 years. I'm in a unique position. I can do both.
would you reach out to an office in advance and ask? Because I recommend this for a yoga teacher or a yoga therapist, is contact them and say, you know, I have this particular type of arthritis and I'm looking for somebody who has specialized training or experience.
That's a great idea to do. Unfortunately, you may not always get the answer you're looking for, and it may take you a few dozen tries before you find someone that's there. The bottom line is always that you want to go in, you want to take a look, you want to get evaluated, you want to see where that brings you. And that sometimes is a good place to be because, like we said before, this is a comprehensive approach. It's not one size fits all. Hands work is to help function work. That's where we look at it from a PT perspective, is that everything that I'm doing manuals, I'm trying to get your joint to move better so you can move better, so you can take that joint and move it even better. That's how that one works.
And Dr. Carl, just a quick question. Do you suggest that people warm up before they do the stretches that you showed?
The nice part with those exercises that I showed is a lot of them are actually kind of warm-up style things. So they are easy range of motion things to do. They are easy range of motion movements to do. If you wanted to go out for a little walk and do a little bit of, you know, get some heat up a little bit, and because that helps you move a little bit better, or if you've got a stationary bike at home, by all means do that. Anything that will make your body more pliable is always there. Whenever the body is warmer, it does move better. The nice part though is that when you're doing simple motions, even things like Tai Chi and stuff like that, you don't need a special warm-up for it because the movement is the warm-up. The movement is making you move. Get out in the garden, go dig a hole. Anything that you can do for movement is a great thing.
So, and of course he mentioned Tai Chi, so I have to give you an opportunity to speak to that. But also there's a question about lymphatic massage and inflammatory arthritis.
Yeah, so lymphatic massage is an extra training beyond being a licensed massage therapist. So you need to find a massage therapist that's specifically trained in that. But yes, it could be really helpful. It is a very light touch. So it's not what you think about when you think about massage, but it can be very helpful for your immunity, for if you ever get swelling in any particular or edema, it can be helpful.
Okay, there's a question here about dry needling versus acupuncture, and acupuncture and acupressure after surgery. So dry needling is a technique that's used by physical therapists that does not use the same theoretical model as acupuncture. So it does use needling, but it's when I talked before about the movement of energy and the meridians and the channels, that's different from how a physical therapist is using the needle. So it's the same instrument, but a different practice with the same instrument. Carl, is there anything that you want to say about dry needling?
It's a great tool after surgery. We use it all the time, especially for scar tissue mobilization, where the portals are. Obviously, if there is sometimes we've got muscle that is atrophied, we have used that for stimulating muscle firing and things of that nature. And also too is that you might have some areas that because of the surgery, we're trying to get other things to move and can't. It's a good kind of additional procedure that can be added in to create a different effect down the line in a distal area to get something more proximal working. So again, it has a good conjunction usage. But again, unfortunately, the big thing, even after surgery, is you've got to move the joint. You've got to move it. There's no substitute. And after surgery, moving joints is not pleasant. It is not.
I'll
tell you, I've been there. I've done it. I do it every day. And people come in, they're going, that does not feel good. And I'm going, yes, I know. That's why we do it small. That's why we do it easy. But for the love of God, you've got to move it, because the first 2 weeks are not happy times. But the more that you do it, the easier it will get and the better you will feel.
And of course, it depends on the surgery. You know, how soon you're supposed to be moving and what kind of movement you're supposed to be doing. And you'll have movement that's appropriate and prescribed by the physical therapist. The evidence for physical therapy movement post-surgically is far, far greater than the evidence for dry needling after surgery. The dry needling is operating mostly from a musculoskeletal perspective, what's happening in the muscle fibers versus, as I said before, what's happening energetically in the meridians. So different strategy, different approach. There's another question about chiropractic care being safe after spinal surgery. Again, that depends. What was the surgery? Because there are all kinds of different surgeries that could happen in the spine, and the safety and appropriateness of chiropractic care is going to differ. Remember, I said chiropractic care is not just spinal manipulation. So you can go to a chiropractor post-surgically and they can recommend movements. They can do gentle joint mobilization. They can talk with you about nutrition, those sorts of things. So it doesn't rule out chiropractic care in general post-surgically, but certainly you should be asking what the recommendations are from your surgeon. Usually you get sent to physical therapy post-surgically, but you could always ask about whether chiropractic care is appropriate, and any scans, any information that you have from your surgeon, from your medical team, should be shared with your chiropractor. Oh, so there's a question about biofeedback. I was just saying that some psychotherapists do biofeedback. And so psychotherapy is covered by Medicare, and therefore biofeedback could be covered under a psychotherapist. But biofeedback could also be done by a physical therapist and other healthcare providers too. So biofeedback by itself may not be covered because it's not a licensed profession. It's a certification, but it could be covered under another license. Okay, anything else that either one of you want to add before we wrap up?
I'd just love to say I've been doing Dr. Paul Lamb's Tai Chi for Arthritis program, which I got into around the same time I got into yoga for arthritis with Dr. Moonaz. And it is so helpful, and it does involve Tai Chi and Qigong, involves getting in touch with those meridian points. So there's certain movements you do that you may not be touching, but the idea is that it's like a massage. So that might be another way that you could incorporate the touch therapies and working with these points, but also it's just a great gentle movement practice for arthritis with evidence to support it.
Wonderful. Thank you, Anne. All right. Thank you, everyone. So glad that we were able to take this time. Great questions. And I will turn it back over to Robin to close us out.
I just want to echo that. Thank you so much, Anne, Dr. Moonaz, Dr. Heldman, for your thorough presentation and staying a bit later to take the time to thoroughly answer those questions. So thank you all so much. I know I speak on behalf of our audience that we've all gained a new perspective on touch therapies and how they can be incorporated for an arthritis routine.